Hello, oral surgery colleagues, and welcome to the Oral Surgery podcast. I am your host, Dr. Richard Moore, an oral surgeon based in the United Kingdom. The aim of this podcast channel is to discuss ways of improving practice in oral surgery, thereby creating a better journey and patient experience, and allowing us as clinicians to become better oral surgeons. All discussions on this channel are based on personal experience and opinions, which should be thought-provoking and supplemented with further research and evidence-based practice. Without further ado, let's jump into this podcast. So hello podcasters and welcome to this podcast. I'm joined today by Dr. Sami Stagnell. So hi Sami.
Hello.
How are you?
I'm very good, thank you. Thanks for having me on board.
It's a pleasure. It's great to have you on board. So today we're going to talk about piezosurgery in oral surgery. And before we get going, it would be great for the listeners just to have a bit of a background about you, what you do, where you're practicing, and then we'll kick off.
Yeah, sure. So, like I say, thank you for having me on board. It's really great to be doing this, and I really love what you're doing with the podcast. So, by way of introduction, my background, yes, you're right, specialist oral surgeon. Did several years of general practice as well beforehand, and hospital jobs and all that sort of stuff. And since becoming a specialist, I've done various bits and pieces as well, including things like leadership fellowships and also an ITI scholarship over in Austria for a year, which was amazing fun. And currently managing IMOS. So for those who don't know, and any of your sort of foreign listeners as well, a lot of oral surgery that used to get done in hospital now gets done in the sort of general practice setting under the care of specialists. So I run that for 2 different counties, including London, support some guys there with a contract. And also I'm a consultant oral surgeon as well in hospital. So I do a couple of days a week, and that's where I'm speaking to you from today.
Brilliant. So fingers in many, many pies, as I
Yeah,
think, which is everybody these days, isn't it? So difficult to.
absolutely. I think the correct term is portfolio career. I think that's how we sort of
Oh, okay. That's what it says on your CV. So yeah, I mean, it's you've obviously got a broad experience, and certainly piezosurgery is probably. I mean, I first came across it a long time ago, and it was really slow. And I think certainly myself and most of my colleagues, when we were doing things like sinus lifts or bone grafts, it was just most surgeons are quite impatient, so we just reverted back to rotary systems. So, but I think things have changed, and certainly you and I both use the Acteon Cube, and this system itself, and there are others on the market, obviously, but the Acteon Cube seems to be much more powerful and quicker. So I think probably if we can just discuss the basic principles of piezosurgery itself.
Yeah, absolutely. And I think, like you say, it's one of those tools that most of us sort of came across a long time ago. And it's always been around. So, like, historically, it's been around since the 70s. So, it's not new. And like a lot of things, often it's getting traction and getting things in there. And I think in dentistry, we're really prone to falling for what we think are silver bullets. So we often think that there
Yeah,
are things that are going to sort of be revolutionary and really change the way we do things, and we sort of get hooked on doing everything in one way, and then find often that it doesn't sort of meet our expectations and things. And I think often you need to take these things into context of like you say, your conventional armamentarium, and make sure that you're not replacing things, you're just adding to the toolkit. And with piezo, yeah, I think I'd come across it like you in the past, and it had sort of been out there, but I never really knew what it was or how to use it, because it's not part of our training. It's not something that you get used to, because most people need to figure out how to use conventional handpieces and drills to sort of get good at what they do. But I think it's keeping an open mind and sort of arming yourself more with other stuff that's going to help solve certain clinical problems.
yeah.
And I think that was where it started to become a game changer. So, like you said, you and I came across it, and that's how we met, actually, through the guys at Acteon, who was sort of recruiting people to sort of help drive some of this tech forward. So, I've got to say thanks to Acteon for getting us involved and helping us on that journey, because it has been revolutionary,
Yeah,
definitely. From
definitely.
my
Yeah,
point of view, like, it's changed a lot of what I do. It's changed a lot of how I think. It's made things easier in so many ways, and Acteon they produce some fantastic kit, and it was something that struck me. The guys who who run the gig here in the UK, were very open about getting us involved, but only if we were interested in the product. And I think it spoke volumes for how much they believed in it, and them putting their faith in us in terms of getting involved with it. And it's a piece of kit I sort of couldn't do without now. And in a lot of the private practices I work in as well, I've encouraged people to pick it up as an additional piece of kit, and it sort of has so much scope of use beyond even just oral surgery as well. So yeah, no, phenomenal
Yeah,
piece of kit,
yeah.
definitely.
And one of the big benefits about piezosurgery is that it's very selective in its cutting, so it will selectively cut mineralized tissue, but spares the soft tissue. So we do notice, and certainly, I've done no RCTs on this, but anecdotally, patients are definitely more comfortable after surgery. There's less bleeding, less swelling, and we'll touch on that a little bit later about the literature. But it works very similarly to what people would be familiar with as a dental scaler, although it's probably 5, 6, 7 times more powerful than
Yeah.
your
Well, I
average
mean,
scaler.
it's I liken it when I say to patients, what we're up to, because and often actually the I'll come on to why it's really useful with patients, but actually it's incredibly useful because that's how I explain it exactly the way that you've just said it. That this is like a scaler on turbo. That's the best way to sort of
Yeah,
get patients to understand it, because they sort of like, you're taking my tooth out. Why does it sound like you're cleaning my teeth? And it's sort of explaining to them that this thing is charged in a way, it's designed in a way to sort of mechanically cut bone. But that's also, again, you mentioned historically, like the reason it was designed, the Italians who developed this sort of technology initially, it was for sinus lifts. That was the whole premise
mm.
to piezo-surgery. It was around selectively removing hard tissue whilst preserving soft tissue. And there's, yeah, I know you should, like you say, not done any RCTs, but there's tons of evidence. You and I both know this. There's loads out there that looks at, and it's animal studies predominantly, that look at the safety margins in piezo. You have to produce a lot of force and energy using piezo, and often then it's sort of, beyond what you'd be going out of your way to do harm, basically, to have or create soft tissue damage. So that it's going to be quite a safe piece of kit in terms of approaching certain things like sinuses, like removing teeth that are near nerves. I know quite a few hospital units who have taken this on board as well and are using it for things like coronectomy when the crown is near the nerve, because they'll sort of selectively remove the crown with conventional means and then go to the piezo for sort of backup. And I think it's very useful as well from a medical legal point of view, having it, because if you're using it selectively to try and be safer, I think, yeah, granted, we all sort of practice probably more defensively than we might have in the past, but I think having instruments that make life easier and safer is never going to be a bad thing.
Yeah, no, definitely. And so we've touched a little bit on what you use it for day-to-day practice, but certainly the Acteon Cube's got different tips that
Yep.
that will accomplish different procedures. So certainly, I think one of the big drives from them was atraumatic extractions and bone
Yeah.
preserving extractions. Whether you're considering an implant or whatever your rehabilitation is afterwards, we should still be preserving as much bone as possible.
Totally.
And those tips, they're very much like luxator periotome tips, and they do make a difference, don't they? And
Oh,
I
totally.
think you do it and
Absolutely.
think, oh, I'm not sure anything's working here, and then suddenly you
Yeah.
deliver that tooth with some forceps, and it's just
Oh
grade
yeah,
3
it
mobile
flies
flopping,
out.
and
And I found that it works. I love it on. I use it a lot on pediatric patients. So when you've got
okay,
lingual fives and things like that,
yeah,
and
yeah,
they're in stupid places, and you just think, how am I going to get an application point on this without removing about every other tooth next to it? And just like you say, that ability to sort of gently work your way around the tooth, all of a sudden you put forces on and it flies out, or you put a lot less force on it with something like an elevator, and it just flies out. A total game changer. But again, there was, and I don't know about you, but it definitely took me a learning curve to get this right, because
yeah,
I've helped out a couple of other people who were getting started with it, and I know I definitely made mistakes. And this is the thing: like, it doesn't matter how good a piece of kit is, if you use it badly, it still gets bad
definitely,
results. So
yeah,
I think making sure you've got enough irrigation getting down to the tip, because otherwise those things overheat, I think can create problems if you're not careful, because you're sort of like going gung ho without enough irrigation. And that's probably the only thing I ever criticize these machines for, is the amount of saline that they seem to go through.
definitely,
But I think that's it's a pretty reasonable trade off, given how well you can sort of take out teeth.
yeah,
And it saved me picking up the sort of this straight handpiece or the turbine or whatever on a few occasions to section teeth, just because you know you're going to get that sort of safer elevation of teeth. Definitely, I think
Yeah.
totally a visible difference.
And I think in parallel to that, when we were talking about how you describe it to patients, that it's a scaler on, a turbo scaler, I think the other big thing that I found is that the psychological impact on patients not having the volume of pressure or the amount of pressure that you would put on maybe a luxator or an elevator that is, although it's not pain for a patient, it is quite uncomfortable. And
But
some
it's
patients
learning
don't
as
like
well.
that.
It's
Whereas
learning
this
as
is
well.
it's just completely different, isn't it? Because they just sit there and it feels like they're having their teeth scaled. It is quite noisy, but so is a burr, and there's a lot of irrigation. And as you say, it's really important to bring that tip out completely to irrigate it. But the psychological impact of not having, the pressure and the forces involved in luxation and elevation is definitely a game changer for patients.
Totally, and yeah, it's for me. I think it's the drilling, because I think patients, that's that classic psychological barrier for a lot of people. A lot of people's anxiety hinges around
The dental drill,
that noise,
yeah,
and even if we were not using the air turbines, really in oral surgery, I think it's the notion of it. And I think when you say you're going to get the drill out, people do get on edge a little bit, and sometimes even just if you use the piezo alongside the drill, because I'll often have them set up or both ready
mm,
to use. You're using the drill a lot less, and like I say, it's not a one single solution to every problem. It's just another tool in the toolbox
yeah,
that really just helps make everything easier, and you just know that you can call on it, you know that you can go to it. And you were talking about tips as well. I use it for loads of other stuff. So I use it for apicectomies as well as all the implant sort of stuff, so sinus lifts. And yesterday I was doing block grafting, and I love the bone tips. It's really really useful for that.
yeah.
Ridge expansion, I use it alongside some of the VersaBurs as well for ridge expansion, as well
Okay.
as the normal protocols. So it's such a versatile piece of kit. You're not just getting it for one thing. You can do loads with it.
Yeah, and those bone tips, when you do that block graft compared to a burr, the width of the tip is so much more. I don't know what
Yeah,
they're
you
on
don't
mil.
destroy as much width. Definitely not.
Exactly, yeah. So you just get much more out of your block graft than you were expecting. But I think the other big thing that I touched on earlier is the reduction in swelling, inflammation, and pain for patients by using the piezo as compared to a rotary instrument.
Well, I think it's often because you're not raising a flap.
Yeah,
So, I mean, rarely, and I don't know about you, but like, if I've got the piezo out, I've got it out because I'm intentionally trying not to raise the flap. So, I'll use it on some of the bisphosphonate patients, for example, and people like that, where okay, there's a high risk of surgical, maybe with a certain tooth
yeah,
for whatever reason. I'm trying not to raise the flap. So I think it compounds your thinking. And again, I think most of us, and you and I both place implants, and you and I are probably, uh, you know I think conventionally oral surgeons were never very delicate, because they would never think about things like implants and what was going in there next. I think you and I will both think about this, and I think the modern oral surgeon, newer trainees, are coming through thinking about this in a much more conservative way. So if you can reduce the amount of suturing you need to do, if you can remove the size of the flap that you need to raise, if you can reduce the bone reduction and destruction that you're going to make, then all the better for the patient, all the better for your outcomes. You look like quite a hero, when the patient comes in and they're like, I didn't feel a thing. Like you say,
yeah,
that sort of
yeah,
perceived comfort is so much better. They're so much more comfortable and happier afterwards. So I think the science sort of also, I think, plays to some of the healing factors as well. So there's loads of studies that look at it on a physiological level as well. So it seems to stimulate certain growth hormones and certain BMPs as well that are really crucial for healing. So accelerated healing seems to be part of the mechanism in which it works as well. So that is backed up. So I don't think it's just the one thing of, say, for example, like I mentioned, reducing the number of flaps you raise, but I think in conjunction with other things that it does, it has a total beneficial effect.
yeah, yeah. And there's some evidence with bisphosphonate patients or patients with MRONJ that using the piezo promotes healing, like you've just discussed, and that this may be due to some of the cavitation effects, decreasing the microbial critical mass around that bone that's involved. So it's something that we should probably be considering for patients. Piezo coupled with things like PRF are probably two
Totally.
game changers,
Yeah.
certainly in my career.
Yeah. Well, I mean, I know, and I'm sure you've done some stuff with PRF for this podcast. But the PRF benefit, and you and I are both involved in some research on this as well, aren't we? So PRF is something we are both massive advocates for. But I know if you've ever been to Shukron's lectures in Shukron for some of the more modern PRF, he's sort of the big name in it. For those of your listeners who haven't sort of come across him, it's interesting because his background is in general surgery, and when you go to his 2 day course, he often talks about the fact that PRF is just one factor in many in terms of
Yeah,
managing the improved patient outcome. So I think it's exactly what you just said. Piezo coupled with other things. It's I take it from the Dave Brailsford sort of mindset. Marginal gains. It's all these little things that we do that add
that
up
add
to
up.
bigger
Yeah,
output. And I think refining your technique and knowing that it's not just a luxator, a Coupland's one, and a Fisher Burr that's going to be your sort of your full go-to kit. Knowing that there's other things in there that are sort of really useful. And I think especially now we are seeing more complex patients. I think now that we've got older, more frail patients, polypharmacy, all these sorts of things, anything that's
mm,
going to make it easier to take a tooth out, I just think, why wouldn't you? It's
yeah,
bonkers not to consider it.
yeah. And I think, do you think there's a role for this piece of kit for general dental practitioners in exodontia and on the high street, so to speak?
Definitely. I mean, the thing, I think the biggest hesitation is that people are, it's funny where people will spend their money. People will
Yeah,
buy the weirdest of things and not use it. And I say this when I teach oral surgery, and I'm sure you come across this when you've done your courses. Most people don't do the basics well, and most people are sort of rushing to go and do implants or rushing to go and do other stuff, but haven't invested in a good, decent deck. They haven't invested in other like good oral surgery equipment. So I think one of the biggest barriers is getting mindset to change and getting people to shift their sort of behavioral patterns. But I think the fact that you can do other stuff with it means it's not very limiting. But equally, if you're going down this road of doing things like implants, if you're going down the road of taking on more surgical patients, even if you've got a visiting implantologist, the fact that you've got kit makes total sense. And I mean, I'm going to look at it from another perspective. At the moment, we've got in the UK, we've got quite a lot of incentive in terms of buying new kit for general practice because we get tax relief on it quite heavily because of coronavirus. So if you're going to do it now
yeah,
because right now
yeah,
is the right time to capitalize on 130% tax relief. So it would be mad not to sort of jump on the bandwagon. And like I say, especially when people are in the midst of buying other stuff that they might not use that much.
yeah, definitely. And certainly Acteon, if you buy a cube, I know that they are in the process of putting some courses on that would be included in your price of the cube. So, like we've talked about earlier, it's, you buy this piece of kit, but you just can't watch an unboxing video on YouTube to work out how to use it. You need some tuition from people that are experienced users, and even you and I, it was a steep learning curve at the start. So it's definitely something that you need
Yeah, I
to
think we're
have
lucky
some
that we,
tuition on.
we sort of had each other at that starting point, and Amit Patel as well. Obviously,
Yeah,
is in the Midlands, phenomenal periodontist. For those who don't know him, and it's sort of the three of us as a sort of bit of go between. I think we were really lucky, sort of getting started in this at the same time because
definitely.
we're able to bounce off each other quite usefully. Um, and again, I think that speaks volumes for a lot of things in oral surgery generally. Like finding a good community and hearing people sort of talk about these things, and that's the benefit of these podcasts, isn't it? We get to talk to people about using this. But I think it's like a lot of things, and then like I said earlier on, if you pick it up and buy it in the assumption that it's going to be used for every patient and it's going to be the game changer, that means no one comes back with a dry socket, well then there's absolutely no guarantee of that, and you're just fooling yourself. I think it lends itself, and you have to sort of a lot of stuff, but you have to sort of get in there and try it and use it in different patients and get used to its characteristics, because it is fine tuning. So like you said, there's some really intelligent kit machinery within the Acteon cube, and it's for those who haven't used it, one of the things that it does really well is automate how it responds to what type of bone you're cutting. Doesn't mean you can't change the cutting parameters on their own. So over time, I've definitely learned that, okay, with certain things that I'm doing, like if I'm taking bone blocks, I'll be using um, more irrigation. But for example, if I'm scraping bone off a plate for a curry technique, I'll run it with a bone chisel tip, and I'll run it dry because I don't want those scrapings wet, because
Yeah,
I'll be pulling them off into some other saline or something, or blood. So you sort of adapt your technique to how you're using it, and I think that only comes with perseverance and a bit of mistake making as well, because
yeah,
yeah, I've had dry sockets with these things as well, when I think the early patients, especially when I wasn't getting enough irrigation on the tip, and when I wasn't getting enough down there, I wasn't lifting the sort of luxator tips out quickly and properly enough. But it's interesting, because once I'd figured it out, it made total sense. And then I've spoken on the phone to other clinicians who have bought these things, and they've had the same problems. And
yeah.
the only difference is I'm sort of a few hundred patients down the line. It's like most things in life. It's just experience, isn't it?
Yeah, yeah, and it's sharing all these nuances with new kit that clinicians have experienced to make it better for other people, really. So we've talked a lot about positives about this, and that, it's like when you go to lectures and everyone shows their amazing cases, and you think, where are
Yeah, totally.
the problem patients and the
Yeah,
complications? So, and we've talked a bit about the tips overheating, and I think that's easily solved. You just need to crank up the irrigation and make sure that you remove that tip from the socket. And even when you do the teaching on the animal tissue, it's evident really early on, isn't it, that those tips go black. So that's quite obvious. Other problems or other perhaps areas of using the piezo that you thought, I'm not, I've had some issues with that, or
flow.
how you've no,
It's I'll get straight to it. I mean, you are stood around a while with Piezo. Like, it's definitely not it's a waiting man's game. It's not for you if you want to be rapid. And there's loads of papers that back that up, that overall speed of
yeah,
time. And it's funny because, in surgery you want to be quick, and I say that to all the trainees. Open flaps, and the longer you're operating for, the increase risk of morbidity. And in Piezo, it's slightly converse, because you're sort of taking your time, because it works slower and it is more controlled. And you sort of have to get it in your head that you are sort of working more slowly. And that's the trickiest thing, I think, to get your brain around, is that it does work so much more slowly. And
yeah,
sometimes the patients do wonder what's going on, because you're sort of there for an awfully long time with that scaling noise as well. There's only, we've said that noise is better than the drill. I think after like 20 minutes of it, I think they're bored as well.
yeah.
um, so I think that is the only downside, really, like for me. Like, I think I
But
always end up having to schedule a bit more time if I know that I'm
yeah,
going to get these out.
but it's not as slow as it used to be. And I must say, the older I get, I do find it more therapeutic. I don't know, perhaps.
You say, that is a statement there. I'm
I think, yeah, and it is, because it's. I think it's less frustrating in some respects, but the speed is definitely an element. But I'll be honest, it is not as slow as they used to be. If it was as slow as they used to be, then I definitely wouldn't be using one. But I also think that patients, they want that experience, don't they? Of particularly private patients. And yeah, everybody wants to be in and out with a surgical procedure, but I think if it's slower, it's more controlled, it's definitely got a reduction in post-op
Yeah, and
complications.
there has been a revolution for slow dentistry, and there is, I think, given we complain about the Nash Bash sort of mentality in the
Mm,
UK, and that's not a slight on the Nash, but I think it's the rapid turnover is often sort of the thing that people criticize, and I think where there's an opportunity to slow down, and often I've had to say this to the team as well. Actually, let's not book things as often. Let's not book things quite so rammed
yeah,
in the diary.
yeah.
Let's give ourselves more space and time to sort of breathe and to actually enjoy what we're doing. And maybe it is a sign. Maybe I'm getting as old as you now. The classic FM in the background and my digestive and teeth ready for me after the procedure. But I think it's nicer to take your time. And yeah, I think when patients feel like you're not rushed and you're not just another number, I think the patient experience, yeah, that all contributes to it. Because I think, again, psychologically, those patients, like I say, it's not a perfect instrument. I do get patients who get discomfort with it. That's
Mm,
fine. But I think when they don't feel rushed, when they don't feel like they're just getting shoved out the door, when they don't feel like you're just trying to get through this as quickly as possible, I
yeah,
think the overall experience is much more positive. So I think
yeah.
there's probably some contributory effect there. But yeah, they're definitely the newer machines aren't as slow as they used to be, and I think that's largely down to the power output that they can produce.
Yeah.
But they haven't sacrificed that safety margin.
So we've talked about using this. I use it all the time for private patients. And I'm very lucky that Acteon have provided us with one in our NHS trust. So we have one in the hospital as well. And I just wanted we have a different model as well, that the Metron one that the guys use for osteotomies in MaxFax, and I think that that's historical. That's been there longer than what we've got in oral surgery. But do you have access to it in your NHS trust, or is it something
So I
that's
don't
not?
have one in the hospital, and it's something that's on my sort of my wish list. So that
Yeah,
I am sort of actively pursuing it. But I use it on my NHS patients as well, and I think that's something that in the UK, especially, we've always seen this. The private equipment is typically there as a result of private work, but it
yeah,
crosses over into your NHS patient list because at the end of the day, it facilitates those people being treated. And I think most of us who are pragmatic and sort of forward thinking aren't going to sort of withhold this stuff from our NHS patients. And I think when it benefits those patients and when it improves their outcomes and speeds things up in a service that's sort of even pre-COVID was stretched. If we can improve the outcomes for patients, I'm never going to stop my patients from getting that treatment or getting the best that I can give them if it's there. It makes no difference to me taking it out the drawer and sterilizing it afterwards. If the day goes smoother and I've got less
yeah,
headache, I just think, well, why wouldn't you?
yeah. And if there's a reduction in post-op complications, then
Totally.
everybody's a winner, aren't they? And
I think
certainly
the
when
trade-off for speed is often, the post-operative outcomes, because again, it's something that you see in other procedures surgically as well. If you're not bringing every time that patient comes back, there's a cost, whether it's mental or
yeah,
physical, financial. Like there is a cost associated to that return. You put it in hospital terms, the return to theatre. It gets counted, and I think people often underestimate. Those 15-minute appointments slotted in between other patients add up. And if you're reducing those, then again, why wouldn't you?
yeah, definitely. Listen, well, it's been really interesting chatting. I know that we're very much on the same page with Piezo, and I would be it would be great to see more people getting involved in using it. So, by all means, look out for myself and Sami on any courses or things like that are popping up, or Acteon, and I'll put some links below in the podcast details about where you can find more information. But it's definitely something that I would encourage people, oral surgeons as well as general dental practitioners carrying out a lot of oral surgery, or even IMOS providers at level 2. I think it's something that is part of the armamentarium that you would definitely benefit from having, and well worth having on the side. So thanks very much, Sami. It's been great chatting, and hope to catch up soon.
Yeah, Richard, thanks so much for having me. It was great fun. Thank you.
Okay, cheers.
Bye.
Thank you very much for listening to this podcast, and any resources will be linked in the description. Please do leave a review and rate the podcast on the iTunes store. I hope you join me for the next episode. Goodbye for now.